Hi everyone, welcome back to IMG Pathway Australia. If you are an IMG applying for jobs in Australia, today's video could be one of the most important videos you watch. Over the last few years, I've spoken to IMGs, reviewed many applications, and one thing keeps coming up again and again. Doctors tell me, I have good experience, I have worked in busy hospitals, I have cleared my exams, so why am I still not getting shortlisted? And honestly, it's a fair question because many of these doctors are clinically competent. They are hardworking. They are genuinely capable doctors. But here's something I have learned over the years. Getting shortlisted isn't only about how good a doctor you are. It's also about how well you present yourself on paper. Think about it for a few moments. Before a recruiter ever meets you, before they see how you communicate, before they see how you examine a patient, they only know one thing about you is your application, your CV, your cover letter, and your selection criteria. So those three documents create your first impression. If they don't clearly demonstrate your experience and strength, the recruiter may never invite you for an interview, no matter how experienced you are. So that's exactly what we're going to discuss today. I'll share some of the most common mistakes I see in CVs, cover letter, and selection criteria, and I'll also explain what recruiters are actually looking for, especially during this campaign. So if you are planning to apply this year, stay with me until the end because these small changes could make a significant difference to your application. So let's start with your CV first because this is usually the first document a recruiter looks at. Many doctors think a CV is just a document where you list your qualifications and work history, but it's much more than that. Your CV is your first impression. Before anyone meets you, before anyone speaks to you, your CV is already speaking on your behalf. Let me give you a simple example. Imagine two doctors with almost the same experience. Both have worked in internal medicine for about 5 years. One CV is very clear, well organized, easy to read. The other is difficult to follow with important information scattered everywhere. Who do you think creates the better first impression? Probably the first one. And that's exactly why a presentation matters. Another mistake I see is doctor trying to include absolutely everything. Every certificate, every workshop, every conference. More information doesn't always make your CV stronger. Sometimes it simply makes it harder to read. So your CV should make it easy for the recruiter to understand who you are as a doctor and why you're suitable for the role. You don't want the recruiter searching for important information. You want them to find it naturally. So remember, recruiters review many applications. A well-structured CV is much easier to read than one that feels crowded or disorganized. So before you submit your application, ask yourself one simple question. If someone spends only a short time reading my CV, will they quickly understand my experience and strength as a doctor? If the answer is yes, you're moving in the right direction. Now, let's talk about the cover letter because I think there are quite a few misconceptions about its importance, especially during the NSW campaign. Many IMDs spend days trying to make their cover letter perfect. But in my opinion, especially for the NSW campaign, your CV and selection criteria usually carry much more weight. So that doesn't mean you should ignore your cover letter. It should still be professional, well written, and tailored to the role. But don't spend all your time polishing the cover letter while neglecting the other parts of your application. A strong CV and strong selection criteria will usually have a much bigger impact. Now, let's move on to the selection criteria. This is probably the part that many IMGs find the most challenging. So, one mistake I see quite often is doctors copying answers from the internet or using the AI for the same generic response for every application. Recruiters can usually tell when an answer is too generic or AI created. So instead, use your own clinical example. Think about patients you have managed, difficult situations you have handled, or times when you worked well within a team. Real examples always make your application much stronger than general statements. Remember, your application isn't about writing that you think the recruiter wants to hear. It's about clearly showing them who you are as a doctor. So when your CV, your cover letter, selection criteria all work together, you give yourself a much better chance of being shortlisted. Thank you so much for watching. If you found this video helpful, please like, subscribe, and share it with other IMGs who might benefit. Don't forget to follow IMG Pathway Australia for more videos on Australian medical jobs, applications, and career guidance. And I'll see you in the next video. Take care.